Good evening and thank you for joining us tonight. Health experts say getting Americans vaccinated is a key factor in reopening and returning to normal. Tonight, more people than ever before are now eligible for vaccinations in Kern County. 23 ABC's Bayan Wang will break down those changes in just a moment. But first, let's take a look back at some of the state's changes and health officials have faced when it comes to distribution. So the first vaccines actually rolled out in Kern County last December. Since then, Governor Newsom attributed low vaccine numbers statewide to a dwindling supply of those vaccines. And early on, only those with the highest risk of getting infected were allowed to get vaccinated. Then as months passed, more people were allowed to get vaccinated, starting first with people over the age of 65, and then of course expanding to people in education and agricultural sectors. Last week, Governor Newsom rolled up his sleeve and got his shot as the state allowed anyone over the age of 50 to get vaccinated. And the state is just 10 days away until it allows all counties to extend vaccine eligibility to those 16 and older. But ahead of that milestone, the state has allowed several counties, including Kern, to get a head start. So joining us tonight is 23 ABC's Bayan Wang, who is live from the mass vaccination site at the Kern County Fairgrounds with more on this big move. Good evening, Bayan.
Hey Alex, good evening to you. You're certainly right. This is a very big move for the county, especially when considering it was only a couple weeks ago when the county was begging the state for more vaccine doses. Now, fast forward a couple weeks, and any 16-year-old and those older than that in the county can get a vaccine.
You can get the vaccine and you can schedule your appointment immediately.
16 years old is not only the benchmark to get a driver's license in California, it now signifies who can get a vaccine in Kern County.
We just needed more vaccine, and we have been advocating to the state, many of us have, that we just need more vaccine. Well, vaccine has started to flow.
That flow expected to bring more than 39,000 vaccines to the county this week, a record distribution so far. But public health spokeswoman Michelle Corson says additional factors influence the county to move ahead, allowing Kern to join Tulare, Contra Costa, and 6 other counties that are allowing people 16 and older to get vaccinated, according to a 23 ABC tally, though there may be more.
We'd also been hearing from our partners that they were not filling all of their appointments. So we felt like that was an indication that now would be a time to seek that approval from the state to open up early.
This comes ahead of the state's plan to extend eligibility to everyone on April 15th.
I feel like that's really good news.
Bakersfield resident Diane Zavala has already been vaccinated and is glad those close to her can now join the club.
I have a lot of friends, family members who have been waiting to get the vaccine, and opening up the date range for that is going to make it more possible for more individuals to do so.
But should a healthy young adult, let alone a 16 and 17-year-old, get vaccinated when health experts have reported all pandemic long that younger groups respond better to the virus than older populations? Local Adventist health doctor Amalika Mangat believes they should.
Absolutely true. Young people who don't have any comorbid conditions may actually do really well, even if they get the COVID-19 virus. The issue is the transmission to others when they are sick, and if they're bringing in the illness, if they have elderly grandparents, parents, siblings that have immunocompromising conditions, they can absolutely cause them to get infected.
And it's also important to remember that it's only the Pfizer vaccine that is allowing those 16 and older to get vaccinated right now. That is the only vaccine that has been authorized by the federal government for them to essentially approve those doses to be administered. The Moderna vaccine, the Johnson & Johnson vaccine, remember, that is only 18 and older as of right now. So if you're trying to figure out exactly which clinic offers those vaccines, Kern County Public Health suggests that you go and visit their website. They have essentially a platform that shows every clinic in the county that offers a vaccine right now. Alex?
And Bayan, just one more question for you. Since the county is getting more vaccines, is the Kern County Fairgrounds mass vaccination site, are they going to start using their drive-through now?
Yeah, Alex, I asked the Kern County Public Health Department that very question, as they've said in the past that when demand rises for appointments and to get the vaccine, that they're going to roll that drive-through out. They said they expect an uptick of appointments now since they've made this move, and they're going to reevaluate whether they're going to put that drive-through out. Whether those operations are going to start in the coming weeks, we'll let you know. Back to you, Alex.
All right, thank you, Bayan. And we know that people in certain industries and certain ages were allowed to get vaccinated against COVID-19 first because of their elevated risks. But data shows that some races are more susceptible to infection and are also more likely to die because of COVID-19. So how are efforts going to vaccinate those groups? Well, as it stands right now, about 30% of people who've gotten the COVID-19 vaccine in this state are white, and Latinos make up the next largest fraction of those vaccinated with nearly 20%. Asian Americans make up about 12% of all vaccinations, and the Black community is roughly at 3% right now. Now, data shows that African Americans and Latinos are at an increased risk of contracting COVID-19, and of all the people infected with the virus, the two demographics are the majority of those deaths.